I wanted to begin by getting you to describe your role a little bit and tell everybody, what does a healthcare recruitment navigator actually do? What are your roles and your responsibilities? What part do you play in the conversations that are happening and the negotiations that are happening to try to bring more general physicians to our area?
Yeah, so that's a great question. So for those who might not know, a healthcare recruitment navigator we're not the same as the recruitment consultants who would be employed by Nova Scotia Health. So instead, the navigators work on behalf of the community and provide community support and resources to visiting healthcare professionals. So some specific things I do in the role would be assisting with finding housing for visiting physicians and professionals. If they need help with spousal employment, partner employment, basically help their families get integrated into our community and show them what it has to offer. So I work closely with the Nova Scotia Health recruitment consultants, particularly in the Eastern Zone where we are, and other navigators across the province as well. So basically, potential physician leads get passed on to me from our recruiters with Nova Scotia Health, and we help promote our communities and answer any questions they may have. So some of my role would be assisting her with planning site visits as well to our area.
I wanted to ask you a little bit because you brought up the idea that there are healthcare recruitment navigators like yourself across the province. So, can you give us a sense of what specific area you're working with right now? Obviously, the name of the committee is Cape Breton South, but we're within the Eastern Zone, which takes in all of Cape Breton Island and northeastern Nova Scotia. Can you give us a sense of what specific area you're targeting right now?
Absolutely, that's a great question. So I guess it's what the local folks would know previously as Strait Richmond. So it is just the town of Port Hawkesbury and all of Richmond County that I cover.
Okay, right on. So I want to ask you then, how would you describe the efforts that the committee has put forward over the past 12 months? You folks have embarked on some ambitious plans. You've been able to have some success in bringing doctors from not only across the country, but around the world to this area, to the Cape Breton South Strait Richmond area. Can you take a look back at 2020 in terms of your own efforts and the efforts of the committee?
Yeah, absolutely. So when I came on and I met the committee, I could tell that they were an ambitious bunch and they were really goal driven. And they took that regional approach by combining the two counties and really working together to a common goal. So that alone was going to bring much success, in my opinion. But looking back at 2020, so although 2020 and the COVID-19 pandemic, it's posed many challenges for everyone this year. But we have seemed to manage to power through, and we're quite successful considering the circumstances. So, in my opinion, in Nova Scotia, due to our relatively low cases of COVID, that alone has seemed to have drawn young families back to our small communities. So, everyone's talking about it everywhere you go, and some of those families include healthcare professionals. So, we have welcomed RNs to the Cape Breton South community, and it's been beneficial that way. Another thing I've noticed, due to the travel restrictions this year, so I work closely with Dalhousie Family Medicine representatives, and because of the travel restrictions, some of those family medicine residents would typically choose to do their clinical placements, maybe back home where they're from, so other parts of Canada. But this year they can't travel, so it's actually allowing residents to stay within Nova Scotia and give them a chance to see practices in our region that they may not have had the opportunity to see otherwise.
Mhm. The sense I get, and I want to tie this into the next question, is that people that are looking at relocating to Nova Scotia to be able to either start a medical practice or take a look at being a doctor at a hospital or an RN at a hospital or at any kind of collaborative care center like the one in Port Hawkesbury, they're not just looking at one community in Nova Scotia. They're not just looking at one area. There might have been a time where people were really zeroing in on the urban centers, Halifax or Sydney. But it really seems now that the doctors and nurses and other medical professionals that are looking at Nova Scotia are looking all over the province. Can you talk about that a little bit?
Yeah, absolutely. I mean, And I think what it boils down to is the flexibility and the work-life balance that we have in this region. So, RNs and physicians especially can come now and they can practice, they can make their practice what they want of it. So you're right in saying that they don't have to be stuck at one specific place. They have the ability to travel. So if they wanted to do their family medicine practice at the Collaborative Center in Port Hawkesbury and fill emergency room shifts at the Strait, they have that ability.
Mhm. And part of the reason I bring that up is because we're getting word now that we do have two locums that are in Nova Scotia and specifically within the Strait area from Ontario, and they have been pulling a number of different shifts. Last week at Port Hawkesbury Town Council, Deputy Mayor Blaine Macquarie gave an update on the situation and described the two locums that are in from Ontario as having pulled several shifts at the Strait Richmond Hospital, at St. Martha's Regional as well, and at the Collaborative Care Centre that's now on Reeve Street in Port Hawkesbury. So I wonder if you could tell me a little bit about the success thus far of those particular visits and just the general atmosphere as you're looking at the way that visiting doctors and nurses are looking at the Strait and looking at various communities around the Strait.
Yeah, absolutely. So you're right. This past month, we did welcome two new locum physicians, both from Ontario, to the region. So they have been traveling around just to try and see, I guess, what practice or what facility best suits them. So they have spent some time at Strait Richmond Hospital, St. Martha's in Antigonish, the Dr. Kingston Clinic in Lordways as well. And it's been beneficial having them practice here to us. It really allows us to put our best foot forward and showcase what our communities have to offer and help welcome them and their families to the region as best we can. Um, so the idea to locum is that they are interested in potentially relocating in the future. So for them to be able to travel and see all the different sites, is huge. So whether we're the perfect fit for them or not, it's a benefit to us to have them there because one thing that we do know is physicians talk to physicians. Physicians recruit physicians. So they have the experience here and they know what our region has to offer. And if it's not for them, they're going to talk to 12 or 20 other physicians along their way, and maybe it will be for someone else.
Right. Looking ahead then to 2021, I'm wondering if you can talk, Maggie, a bit about what the Cape Breton South Recruiting for Health Committee has planned for the new year. Is it basically building on what's been done, or are there some new strategies that you and your colleagues are working on right now? What can we look forward to in the new year?
Yeah, so from here, I guess we continue to develop our online presence through our social media platforms, and our website is very close to being launched soon. So the community will see that come out shortly. Um, so it's important to note too that although right now the highest need seems to be for physicians in this region, our goal as a group is to assist with the recruitment retention, of all healthcare professionals. So that's, your CCAs, LPNs, RNs, paramedics, you name it. We're basically here to help. So one of the things that I'm currently working on and I hope to deliver in the new year is an information session to present to students and their faculty who are in school now. So, I hope to present to the RN class at CBU, get into the Strait area campus here and present to the CCAs and graduating LPNs, just so they have a better sense of who we are and what we do and how we can better support them along their education journey. So my hopes that by doing this is that I will find those students who are interested or plan to stay and practice in Cape Breton South. Once I know who they are, that way I can better support them. Whether it's by the group sending care packages or setting up a tutor within the community or long-term rentals, daycares for their children, whatever it is, it's just to get the awareness out there so people know that our group is in existence and this is what we're here for.
Right. Last question to you, Maggie, and this is very much a personal question. I mean, I have talked a little bit with you over the last few minutes about the very specific technical issues that come with your role as healthcare recruitment navigator. But we both know as well that physician recruitment has been an issue in Nova Scotia for the better part of 25, 30 years. So I'm just curious as to how you feel being in a position like this right now. A lot of people look to you as being someone very important because you're basically pitching Nova Scotia and pitching the Strait area to so many potential doctors and nurses that could relocate it here. What does that mean to you on a personal level that this is where you find yourself at this point in your life?
I guess when I started this position, I didn't realize too how many people and how many organizations would have such an interest in what I do and the progress that we're making. So I realize it now, and I'm actually honored to be in the position. Um, I have a great team of people that work behind me. You know, whatever I need, the support is there, the resources are there. And you know, when we all work together, this collaborative approach, it's what's going to bring success. So I'm very happy and yeah, honored to be in the role.
Well, that's terrific. We have covered a lot of ground in just a short time, as I thought we would, and I appreciate you giving me a few minutes here, Maggie. Did you want to add anything else about all of this just before we wrap up?
No, you asked a lot of great questions. I guess I would just like to put out there that if there are any community members, you know, interested, we always love hearing from you. I just can't stress enough the amount of how important community support is in this role. So if there's any questions or anything, I'm just a short email away, and don't hesitate to ever reach out.
Well, we know you're doing very important work right now, and we appreciate you taking some time away from that important work to reach out to us and to share a little bit about what's involved in bringing new doctors and nurses to this area. So, Maggie MacDonald, thank you very much for joining us on Telile 24/7 today.
Thank you for having me.
No trouble at all. Maggie MacDonald is the Healthcare Recruitment Navigator for the Cape Breton South Recruiting for Health Committee. We've been speaking to her today by Zoom from her office in Port Hood.